Hi, everybody. Thanks so much for joining today.
You're welcome.
The online people, as well as everyone that's here. My name is Keri Anne. I am an employee of Weiss Hospital, and I've been in healthcare for a very long time, for like 21 years. But more importantly, I am a certified nutritionist as well as a personal trainer. And I am a DNA-based life fitness coach, which means that based on your genetics, if you took like a DNA test, for example, if you got the results, I can analyze your genetics and tell you what will work for you as far as eating and as far as nutrition is concerned. Okay. So that brings us to our topic today, which is dehydration. So before we start, I just have a couple of questions. I just have one question. What did you guys drink today? What did you drink this morning? Water. Water and coffee. My goodness, that's a lot. Okay.
Water and tea.
Water and tea.
Water, coffee, and juice.
I can't deal. Okay, my uncle didn't did 3.
Water and water.
Water, coffee, and tomato juice.
Water, coffee, and juice for Janice.
Water and a fruit smoothie.
Oh, okay.
Water and coffee.
Water and coffee. Anybody else?
Me too, same thing.
Water
Coffee and then water.
Water at each exercise class, 3 exercise classes.
Okay, so you drank water at the exercise class. What did you have, sir? Milk.
Water,
Mhm.
and tea.
You had a lot. That's pretty good. What did you have, Carol? What'd you have? Water and juice. Okay. Dad, what you have? Okay, water and juice. I didn't hear you participate, sir. Okay.
I had milk in the coffee,
Oh, you did?
about half.
Okay, okay. So for myself, I've only had water. And if you were here, you could see my big bottle. I have like a 72-ounce bottle of water. I'll show you guys later, but it's a big bottle. So I could probably grab it. So for the people, can you guys see?
Yes.
Yeah, that's mine. And I'm halfway. So that brings me to my next point. Water is very, very important. Okay, so what is dehydration? Dehydration happens when you don't drink enough water. That's what happens when you are dehydrated. You don't drink enough water. When your water content is too low. So the slide says, what can cause dehydration? So as we know, when it's hot outside, like it's hot today, and we're not drinking enough water, we can get heat exposure, which means that we're going to get hot, our temperature is going to go up, we can become ill, fever, vomiting, diarrhea. And we know when we get diarrhea, we're losing the water or the fluids that we're taking in. So that means that we can't become dehydrated because of the diarrhea, because of the vomiting. We're vomiting, and it's fluids and food and things like that. If we don't replenish, then we can become dehydrated. The fever as well, you're hot. You would think that you would want to drink, but you're sick, so you may not feel like drinking. Mobility problems. If you're unable to move around, it may be difficult for you to drink water because you don't have access to it. Other underlying health conditions such as diabetes or kidney disease can also cause you to lose more fluid than normal. And then medications, diuretics, everybody sees the slides, but it says the side effect of some medications may be increased urination, which can cause additional fluid loss. Some examples of medication that can cause increased urination includes diuretics. So people know that when you take water pills, you go to the restroom a lot. Anybody take water pills here? You go to the restroom a lot, right? So that means that you need to continue to drink to replenish, right? Anybody at home take water pills? They can relate to that? Okay.
Take what?
Water pills.
Yes, I take a water pill, but it doesn't make me do that,
Oh, really? Oh,
really.
you lucky.
I just go normally.
Oh, okay.
What are water pills?
Oh,
What are
okay.
those for?
Water
It
pills
helps
can,
with my blood pressure.
yes, thank you.
Oh,
Yeah.
mhm.
Okay, moving on to the next slide. And you guys remember one thing, I am not clinical. So, I mean, it's some things that I can't answer, but I'm not a doctor yet, maybe one day. But I'm gonna do my best to answer as many questions as I can and to cover as much information as I can. Yeah, and then some things that I can't answer, I will always recommend that you speak to your doctor. Like, if you had something that I couldn't explain that was more clinical. Okay, so we do need to know that your body makeup, the body makeup for the water, body water makeup, I'm sorry. So it says your brain is made up of 73%. It says water, I'm sorry, your brain is made up of 73% water, and so is your heart. Your bones are 31% water. Muscles and kidneys are 79%. So that's why it's so important, to drink water. You see, it regulates your muscles. It regulates your kidneys. It regulates your brain. It regulates your heart and your skin. Like some people say that, I hear a lot of people say, and I never really thought about it until today, oh, you have such beautiful skin, not to me. Well, I mean, I've heard it, but to some people, you have great skin, you have great skin. And I understand now if you're drinking water, that contributes to it. So it says a whooping 83% of water makes up your lungs. So if we look at the chart here, it says newborn babies are about 78% water. So that's just a small baby. A year-old baby is 65% water. Adult men, 60% water. Adult women, a little below, 55%. And it says between 55 to about 78% of your body is made up of water. That makes sense, right? Okay. Now, you have a question? It could be related to that. See, water contributes to so much in our life. That could be one of the reasons. It could be, it could be genetic, yeah. And it might be a question for a dermatologist too. Maybe you need to, some people just have dry skin in the winter time. Sometimes our skin is a little drier. And sometimes in the summertime, it's a little more moist. But that could be a reason too. I heard you today say you only drank one. It's a little bottle of water today, right? So no, I already had 2 cups of water. So 2 8-ounce cups. Yeah. Oh, okay. So you halfway there. Yeah. Oh, okay. Yes, Daddy. You can. I read something where you can become intoxicated, right? If you drink too much water. They recommend, and I was going to cover that, 8 glasses of water a day. Is that a lot? That's not a lot. I've drank about, no, you need 8. You got to increase it. You got all day. It's 12 o'clock, And you know what, guys, you have to pace yourselves. Like, and I know me, and I know other people can relate. You worry about going to the bathroom, like myself, I'm like, oh my God, if I'm not at home or in a place where I know I can use the restroom, I might not drink a lot because I'm afraid that I might have to go to a public restroom, and I don't like public restrooms. My husband could tell you that. But I want to be in a comfortable place where I can go to the restroom. But we still need to get our water in, and we have to be conscious of maybe the surrounding areas where we can go to the restrooms. Because like today is hot. We need to drink we need to drink water. We need to drink water. It's very hot outside today. Yeah. So does that answer? Everybody, can we work on the water? 8 cups. Yeah, we could do it. Just pace it out all day. Okay. Moving on to the next slide, guys. Okay, so signs of dehydration. So for diabetics, a lot of diabetics have a dry mouth. And then it says few or no tears, or you may not be diabetic, but still get a dry mouth. But I know that's one of the things that diabetics experience. Tiredness or fatigue, you're extremely tired, sunken eyes, and a decrease in urination. So if you're not drinking, you can't urinate. Okay, and it also says urine that's a darker color than normal. So urine that's a darker color than normal. Muscle cramping, so your joints, you're having pain, you're having aches. Confusion can also be a sign of dehydration. Constipation, definitely. When I don't drink enough water and I know I'm like, oh, I haven't been to the bathroom, I need to get some more water. And as soon as I drink the water, I'm successful. Yes, ma'am.
I wake up sometimes
Mm-hmm.
with a muscle cramping in my calves.
Mm-hmm.
Is that? you think because of-
It could be. It could be. So many things point out to having a lack of water. It's like amazing. When you increase your water intake, I'm sure you will feel different in some areas. And then, I'm speaking to an older crowd. It could be arthritis too, or it could be that you're not. It could be a combination of things. But my suggestion today is just to increase your water and see if you see anything different. Like if you see, oh, it doesn't hurt as much. But you've been asleep all night. So, me too. When I get up, I'm like, oh my God, my bones hurt. Let me stretch. Let me do some
Well, this is
exercise.
cramping that will,
Mhm.
it's sudden and it really hurts like milk.
It does. So then when you start your day, is it getting better?
Oh, yeah, it'll go away.
Yeah.
It's only, flash.
Yeah. And it could be because you're just waking up. You have to stretch. You have to, everything needs to move around, Yeah. Yes, ma'am.
I've had cramping and I asked my doctor about it.
Mhm.
He says, do you like gin and tonic?
Oh,
I said, I hate gin. He said, well, forget the gin and drink a small glass of tonic water before you go to bed
Mhm.
and you won't get those cramps. And I did it and I don't get cramps anymore.
Okay.
Well, that's wonderful news.
Yeah.
Thank you very much.
And I was also reading about water that contains electrolytes. That also could help as well.
Smart water.
Yes, smart water. And they recommend other things like Gatorade helps with electrolytes, but certain water like smart water does have electrolytes to give you that boost. So I would recommend trying that as well. Yeah. So, but the muscle cramping, like you said, that is one of the signs of dehydration, confusion, constipation, feeling dizzy or lightheaded as well.
Somebody wanted that question repeated.
Oh, what they say on?
I guess it was, I don't know.
It came up good sense.
It came up. I'm looking at the chats. Somebody, Karen, she asked for the question to be repeated.
Oh, the question was, when you wake up with cramps, is that a sign? Is that a sign of dehydration?
Okay, thank you.
Yes. Do you have cramps sometimes?
No, but there's no way I can drink as much water as I used to because I have some level of incontinence and I just don't want to, I'm busy and, I cannot drink as much water as I used to. So I just wonder, what do you suggest in a case like that?
When you can't drink as much water and you're saying because you're busy?
No, because I have some level of incontinence.
So it's medication out there that does help overactive bladders. My doctor recommended some medication.
Yeah, I do take medication, but still, it's some level of it. And so I'm just really hesitant to drink a lot of water. I wish I could.
You can also, and I'll cover that as well. You can also, it's certain fruits and vegetables that you can eat that'll also help with that water intake.
Okay.
So that would be something
also for the lady who's having some incontinence problems, there's a program offered by physical therapists in some hospitals called Total Control, and it helps you with that. But since the pandemic, a lot of those places don't have them now, but you can call them and see if they'll have some in the future. But Total Control classes.
Oh, okay.
Yeah.
Mm-hmm.
Thank you.
It works with your pelvic floor.
Yeah. I've done that. Yeah.
Weiss
Thank you.
does offer that. It's a therapist, a couple of therapists here that specialize in that.
Mm-hmm.
Yeah, those are great questions.
Thank you.
No, thank you. So these are more serious side effects. So trouble with movement or walking because you're dehydrated, feeling irritable, confused, or disoriented. Anybody ever feel like that? Cranky, yeah. Yeah. Yes.
All the time.
All the time. My uncle says all the time. My dad says all the time, and Judy says all the time. Fainting. I know sometimes people have spells where they faint, so it could be because they're dehydrated. Diarrhea or vomiting that lasts longer than 24 hours. These are more serious effects. Sleepier than usual without reason. Inability to keep fluids down. Bloody or black stool, and a rapid heart rate. So these are some more serious side effects. So if you continue to experience these, I would strongly suggest that you speak to a doctor, because sometimes it's escalated, because when you're dehydrated, it can, escalate quickly. All right, guys. So some results of dehydration. This is what can happen because you're dehydrated. Urinary and kidney problems, including like UTIs. Anybody ever had UTIs? It's kind of common. Anybody ever had urinary tract infections? Kidney stones, which are very painful, I hear. Kidney failure as well. Seizures due to low levels of potassium and sodium. You can get potassium from bananas. Heat exhaustion or heat strokes. Hypovolemic shock. Threatening complication that causes a drop in blood pressure and oxygen levels due to low blood volume. So these are results. So when I research what hypovolemic shock is, it says severe blood other than fluid loss that makes the heart unable to pump enough blood to the body. So that's what that means. Okay. So just to help with potassium, bananas, avocado, anybody like those things? Okay, spinach, oranges, and melon. Those are some things that help with potassium. Okay, so these are some pictures, and it says top water rich foods. So these are things that we can eat. So we can't, maybe, I think it was Karen that said that, she prefers not to drink a lot, or she's unable to. So from certain fruits and certain vegetables, you can get your water. Cucumbers, put them in salads. Even lettuce has a lot of water in it. Tomatoes, that goes in your salad. Watercress, grapefruit, which is great. Spinach, lettuce, there's your salad. Broccoli, watermelon, carrots. Watermelon is 96% water, which is awesome. All of these are pretty high. So these are just some of the things that you can incorporate in your diet. Like today we have a salad. So there's some water that we'll intake, and some, I don't know if it's tomatoes there, but these are things, I see carrots too. These are things that we could just eat every day that will help us with our water intake. Fruits and veggies. So broccoli again, watermelon, pineapple is great. Celery, tomatoes, cantaloupe, strawberries, cucumbers, grapefruit, and lettuce. So these are things that we should be doing. Okay, so this slide just explains, it says, what does water do for our body? And this is just what we were saying earlier, that it says studies suggest that everyone should drink between 56 and 64 ounces of water per day, which works out between 7 to 8 ounce glasses per day. Has anybody reached that goal today yet? Come on, y'all. Nobody?
Not yet.
What you mean? I did it.
What about the rest of the day?
I started at, no. Oh, what about Eric? Nobody has. Anybody, Carl, did you get it? Oh, Carl is the king of water. Nobody? Okay. Well, we can gradually do it, so that's fine. And it says elderly people may be less likely to want to drink large quantities of water so they don't spend their entire day in the bathroom, which is really, really, that's true. I totally agree with that. It's not just elderly people, it's me too. It's anybody. So they shouldn't say that like that, but yeah. So for example, they say if you weigh 150 pounds, you should aim to drink 50 ounces of water each day. We could try that. So mineral water and alkaline water may be some of the healthiest types of water because they provide your body with essential nutrients like electrolytes, like we were saying. But simply drinking safe, uncontaminated water should be your #1 priority. Okay, guys? So like they said, faucet water is okay as well. That's fine, you're still here, you're doing. You okay? Yeah, it's okay. Yeah. Yes.
Chicago got some of the best water going.
There you go.
Absolutely.
Yeah. All the states around the Great Lakes have the best water.
Mhm.
But it's, I told you, that's my dad. You know what? You might, maybe not. I don't know. I have to do some research on that. You think that's a question? I don't think so.
What's the question?
If you boil water and then freeze it, is that okay? I think that's okay because it's still water.
Yeah, it's still water.
It just gets hot. You cool it off and freeze it, it's still water. What's the point in boiling it in the first place?
So because it's a story, I'll tell you that.
Oh, okay.
But we can get the thing for your faucet, remember? Yeah. Yeah, a filter. Yeah. Okay. Okay. For purifications purposes, I think. All right, so tips on drinking more water. I think you guys have like some papers that you could definitely take with you and just reference to at home. These are very, very important things that you could just, you know, when you have time just to review them, just so that you can stay on track with drinking water, because it is very important. It says, remind yourself throughout the day to stay hydrated after meals or during exercise, especially when you're exerting yourself, you're doing exercise. Like when I'm in the gym and I exercise, I probably drink like probably close to like 32 ounces of water or more. I probably drink more than that and within less than an hour, because you're exercising, you're sweating, you're hot, you know. So it's important. So after meals or during or after exercise. So during exercise, after exercise, you should be, I need to drink, I need to drink, I need to drink, because you're exerting yourself, okay? So carry a bottle with you, keep it filled. So I have like a couple of bottles in my office. I have one that's bigger than this. I have like a 50-ounce bottle. So it's important. That might help you. You got one too. Yeah, that helps. I think that helps. Do you guys agree? That if you carry a water bottle with you, it helps? Yeah, yeah. So carry a water bottle with you, keep it filled. Choose water instead of sugary drinks, including at meals. So, you know, sugary drinks, we all know how that goes. Coffee, I mean, most people drink coffee, but they put so many things in it, you know. That's you. Cream, sugar. My mama, bring me the cream, bring me the sugar. Wait, Mom.
Yep. Mhm.
The other day.
Yep.
Sugar. If you blown it up, yeah, it's sugar. Yeah. Oh, I guess black is okay. I don't drink coffee, but I think that's fine because it's just maybe I don't know. I will have to look at the ingredients that's in it. I don't know the carbs and things, but I guess it's fine. It's not with the cream and sugar.
It's supposed to be really a dehydrator.
What, coffee?
Yeah.
I have to read
Yeah.
it.
Coffee is
But I
a
know-
diuretic.
Yeah.
It's a diuretic. It'll make you go to the bathroom.
That's
Right.
But I know the more you load up, you know, with the
Oh,
sugar.
you just
and
drink it
cream.
black, it's just coffee. You know,
Yeah. So
just water.
you drink it with cream and sugar?
No. Oh,
Yes.
I know.
I drink cream, a lot of cream.
Yeah. So it says add flavor. So to your water, you could put fruit in it, a lemon. Sometimes I put strawberries, lemons, cucumbers. Yeah. And it makes it more, you know, have a better taste to it. I guess some people that are not real water drinkers, that helps them to like think about it and like maybe it's a fruity drink or something, you know. It says you can also try some flavored drink mixes, but watch out for the sugar. So for like what are the little things that you pour? Crystal Light. Crystal Light is good. I think it's it should be almost no sugar in it, I think. So that's a good way as well. But you have to look at the sugar as well in that. I don't know, you know, some people are diabetics that can't take all of that sugar, but I don't think it's that many carbs or sugar in that. So that's another way that you can get water in. It says eat foods that are high in water content, Many soups, fruits, and vegetables meet this description. Watch out for the soups because the soups do have a lot of sodium in it. Some soups, unless, like Judy said, you make them, right, Judy? But a lot of soups, like canned soups, you have to be conscious. And this is the nutrition side of things. Like with soups, if you go to the store, just be more conscious of the things that you eat. Like for the soup, look on the back on the package and look at the sodium intake. Look at the carbs, look at the sugar. I look at everything before I buy it. And you want to just be conscious of things, you know. If you don't like drinking a lot of water at once, try small doses spread out throughout the day. So the little small 8 ounces that we have, take, you know, drink that, but you want to make sure that you try to still meet your goal. Implement easier access to the bathroom. So, you know, if you're going somewhere, just make sure you got a clean, you know where you're going. Okay, the bathroom's here. Okay, I feel comfortable. I can drink my water. I'm not gonna not drink my water. You know, just have a plan, especially as maybe as caregivers, when you take your clients or your patients places, you want to make sure that they have access to a bathroom so they won't feel like they can't drink their water that they need. So
Go before you leave home.
but you got to go all day on. So peaches have water. Zucchini also has a lot of water as well. Lettuce, celery, yeah, some of those things we talked about. Do you guys have any questions for me?
I have a question.
You hate the water. Oh. You hate the water?
I have a question, Keri.
Yes.
I've heard that it's better to drink room temperature water versus ice cold water.
You sound like my cousin.
Is that true?
That Latanya?
Yes.
I can tell. It doesn't matter.
Okay.
It doesn't matter, Tanya. It's all the same.
No,
Doing the
I
same.
just heard that it was better to drink room temperature water versus cold water for your body.
I mean, I
just
guess it
wondering.
depends on the person's body. Some people might not like cold water. I mean, I'll have to do more research on that. I haven't heard
Okay.
that difference. You know, some people like room temperature water, some people like cold. I like both, you know, and it still does the same job, I think. But I will do some research and let you know, cuz.
Thank you.
You're welcome. Any more questions? Yes.
So Tanya.
Yes,
Tanya,
sir.
yeah.
Yes, sir. Hi, uncle.
Hey, baby. Told you that was her. See?
Well, you're saying because of the prostate problem, going to the bathroom a lot? Just like stop it. So you saying how can you drink more water? Because yeah. Because you're not, yeah, and we probably, yeah, and it's something that we could also talk to a doctor about, but yeah, because I don't think you drinking too much water, right? I don't think you're drinking enough. We don't have to sit down and figure it out, but at least like 7 to 8 glasses per day. Like maybe this is 72. So almost, I mean, a little less than this, but at least, yeah, 7 to 8. This is 72 ounces. Yeah. That's too much. But 7 to 8 glasses. Mhm. You can. Anybody else have any questions?
Nope.
Anybody online have any questions?
I have a question. I use a Brita. You think that's okay? I've been using that for a while for my water.
Yes, I think so.
Okay.
Oh, Brita's fine.
I think it's less expensive than the faucet filter.
Yeah, I think so. Well, guys, this is my first time publicly speaking as a nutritionist and as a personal trainer and all of those things. I was very, very nervous, but God gave me the strength. So, and I thank you guys for allowing me to, you know, give you some tips to help you stay hydrated. Yeah, thank you so much. I appreciate your time.
Thank
Okay,
you.
you're welcome.
Bye, guys. Thank you.
Bye-bye.
All right, see you, baby.
Fabulous
Bye,
job. Thank
Love
you.
y'all.
Bye-bye.
Bye-bye. Bye, Keri,
Bye.
Eileen.
Bye.
Bye-bye.
All right, see ya.
Bye-bye.
That's my mama.